Thank you, Mr. President. I come to the floor today to rise to speak to a challenge that our rural health communities face both in Alabama and across the country. People living in rural areas often face difficulty in finding health care providers. The challenges of consistent, quality health care for rural America is exponentially more difficult than any other area in the country. And these persistent gaps in health care inevitably lead to poor health outcomes. As a result, life expectancy for rural Alabamians is approximately 6 months lower than those who reside in urban areas, and 3.5 years lower than people living in the rest of the country. In some parts of my state, the outlook is even worse. In Wilcox County, for example, life expectancy is 9 years lower than the national average. That is unacceptable, Mr. President. The county of your birth or where you choose to live should not dictate the quality of your life, much less your life expectancy. Despite the prosperity some pockets of the country feel today, outcomes don't seem to be improving in many areas in rural America. Alabama's rural hospitals are at risk, and many are in immediate danger of closing. Sadly, some already have. Just last week, yet another hospital, this one in Jacksonville, Alabama, announced that they would close. It's about the 12th, I think, since 2011. It has become an all too familiar pattern in Alabama and in other rural areas in America. That means the quality and number of treatment options in these rural areas and in Alabama continues to decline. 52 of Alabama's rural counties facing primary care shortages, and those numbers get worse for specialty practitioners like dentistry and obstetrics. Having spent nearly my entire life in Alabama, the only one-year exception being in Washington, D.C., working for this body on the Senate Judiciary Committee, I'm acutely aware of the unique difficulties we face in keeping folks healthy. As I traveled across Alabama over the last year, I heard from folks who struggle to access medical care. I've heard from expectant mothers who didn't know if they'd be able to make it to a hospital in time for delivery because the closest one was more than an hour away. I've heard from people who are impacted by the growing opioid epidemic and the lack of substance abuse and mental health treatment options in their communities. So when I came to the Senate, I knew I needed and wanted to make increasing access to quality, affordable health care one of my first priorities. I also knew that finding the holy grail of true health care reform in today's world of partisan politics is a difficult and complex task. But I'm proud to say that we have made some progress since I got here in January. For instance, through bipartisan efforts, the Expired Children's Health Insurance Program, CHIP, which provides coverage to 150,000 Alabama kids, as well as community health centers that serve 350,000 Alabamians, was funded for additional years in the future. I'm proud that we secured a 3 years funding for the community health centers that in that bill, which provide primary source of health care in many underserved communities. I was also co-sponsored the Training the Next Generation of Primary Care Doctors Act, which was signed into law as part of the bipartisan budget deal. That legislation is critical for folks in my state. In the training it provides to doctors in community health centers and in rural health clinics, but also it ensures that talented individuals who choose to stay in the healthcare profession stay and practice in their communities. Mr. President, bipartisan legislation like that bill is one of the many ways that we can improve how folks receive health care in the United States. There's, of course, another option which leaders in Alabama have failed to make, and that's to expand Medicaid. By failing to expand Medicaid, many of Alabama's most vulnerable citizens have been denied access to basic care, and we've turned away literally billions of our own taxpayer dollars in the process. that decision just doesn't make sense. While I'm hopeful that my state's leadership will reconsider the short-sighted decision made solely for political reasons, I'm going to continue to work to find ways to help. For example, I want to continue to advocate for changes in the Medicaid wage index, which is unfairly hurting Alabama health care providers and has been doing so for years. But for my part today, taking one additional step, proud to say that my very first piece of original legislation will focus on improving rural health care through making government more efficient. Today, along with my colleagues, Senators Mike Rounds and Tina Smith, I'm introducing the Rural Health Liaison Act. I want to acknowledge and thank Congresswoman Cherry Bustos for her leadership on this issue in the House and her offer to partner in this really important effort. The Bipartisan Rural Health Liaison Act will streamline federal investment in rural health care and improve coordination between federal agencies and other health care stakeholders by creating a rural health liaison within the United States Department of Agriculture. I believe that the USDA is the appropriate spot for such a position because the department plays a major role in rural development efforts. For instance, USDA has the capability to finance the construction of hospitals, to implement telemedicine programs, and carry out health education initiatives. We want to make sure that these efforts are fully coordinated and leveraged with the U.S. Department of Health and Human Services and other federal agencies, as well as other important healthcare stakeholders. Among other things, the Rural Health Liaison would consult with HHS on rural health issues and improve communication with all federal agencies. It would provide expertise on rural health care issues. It would lead and coordinate strategic planning on rural health activities within the USDA, and it would advocate on behalf of the health care and relevant infrastructure needs in rural areas. I thank Senator Rounds and Senator Smith for their support on this important legislation, and I look forward to working together with them and other colleagues to move this bill forward. Mr. President, this is a great example of how senators from both sides of the aisle can come together to propose common sense legislation to make government work better and more efficiency. It is exactly the kind of work that I hoped to do when I arrived here just a few months ago. But this is just another step in a very complicated process. In the months ahead, I hope to have the opportunity to continue to work with colleagues on both sides of the aisle in this body to lower health care costs, increase access to quality health care, and to improve the health and well-being of people living in rural Alabama, in rural America, and in fact, for people all across this great nation. Thank you, Mr. President, and I yield the floor.